Now, we have seen cases where a client goes out of network with a PPO plan, and those same service for an adult hygiene appointment, cleaning, exam, and x-rays, is still covered at 100% with no copayment. And now I will emphasize, those are outlier plans. That's not common. Those are outlier plans, but we have seen that. And of course, that's a good news story. When you're in network, cleaning, exam, and x-rays were covered at 100%. You're out of network, they're covered at 100%. But now the difference is the doctor is getting paid a lot more. The office is getting paid full fee for those. Now, other cases we typically see a relatively minor copay for cleaning, exams, x-rays. What do I mean by relatively minor? $22, $24, $26, $36, $44. That's where the majority of them fall. Now, I'm not saying $44 is chump change, Naren, but if the patient comes twice a year, that's $88 a year. Most people would, many people would choose to pay the $88 to go to the office they want to go to for those services. And then other plans, it might be $100 copay. And then on the extreme other side, I've seen plans where when you're in network, cleaning, exam, and x-ray is covered at 100%. When you're out of network, the copay is $240. Now, can we agree $240 is radically different than 22, 24, 26, 36, 44?
Agreed.
What would make the difference? Why would that be?
It's just a plan that the employer signed up for.
It's the amount of benefits that they bought. It's the plan these plans, every Delta plan doesn't pay the same thing because the employer can customize that plan. If they really value their employees, they can provide better benefits under the plan, which means their premiums higher. Their premiums are higher. And so when we see a good plan, it simply means that those employers, they tend to be more private employers that do that because they value their employees and they're competing for the workforce. Right. Public employees, city workers, public safety officers, policemen, firemen, first responders, we tend to see lower benefits there, because they have tighter budgets. But they're not all the same. If a company really values their employees, they can buy a policy that would cover very well. Right. Or they could go the other way and get real cheap on it, like the one that requires a $240 copay, and then get really cheap. So that's why there's differences. So I'm interesting to see the table to see that. But I think what we're going to see, or what the push is going to be from the top, is to get benefits reform, require dental insurance companies to cover certain things, like a missing tooth, that will have to be covered. And in turn, those insurance companies, because they love what does the insurance company love more than anything else? Their profits.
Yes.
They will have to raise their premiums that they're charging to their employers that are buying these policies to get that done. But it's kind of cool that there may, and I emphasize may, it remains to be seen, but I'm hopeful that we're going to see some benefits reform. And we're going to see things that historically haven't been covered. I have always had a fundamental disagreement, Naren, that if something isn't covered under the insurance policy, the insurance company should not be allowed to set your fee for that service. In other words, if they're not paying anything, why should they set your fee? But they've been able to do that, to set your fees for implants, for veneers, for cosmetic veneers, for adult orthodontics. They've been able to set your fees for that. And if you're a participating provider, you are required to honor their fees, even though they don't pay any benefits. That's part of what I see in the reform. That's more insurance reform than benefits reform, but that's part of what I hope to see, where they're not allowed to do that anymore. Why should they get a choice on setting a fee for something that they're not going to provide any benefits for? That should be excluded. And that would have fallen, as I mentioned, more under in insurance reform. Now, this doesn't change anything when it comes to, should you be in network or out of network? Not at all, except that we teach an approach, Naren, that's very patient-friendly. In other words, we let our patients know they can still choose our office for their care. Whatever benefits they have, they can use them right here in our office. We'll file their claims for them. There are other consultants that take a different approach. where they just wash their hands of insurance and basically hand the patient a claim form and say, here you go. If you want to get, any reimbursement from insurance company, any of that's up to you from now on. We disagree with that. We think there's a useful approach to be patient friendly with that. So what we're going to see, you're still in a better position to be out of network for the simple reason that when you're out of network, you get to set your own fees. You don't have a third-party meddler in the form of a PPO plan setting your fees. You get to set them. But I think this might get more patients to the table if they get some benefits reform. More people that have missing teeth will be interested in getting that covered. So I think it's good news. It's kind of a good news story in the midst of what is typically bad news when we talk about dental insurance. It's kind of a good news story. So that's why we want to share it with you all. Well, guys, as we come to the finish line today, we'll put a link in the show notes for this Less Insurance Dependence podcast for the interview that I did with Dr. Kessler. We'll put that in the show notes. So just go to lessinsurancedependence.com, hit podcast, scroll down to the top where you'll see this episode. And if you scroll down, you'll see a link to that. Click that and you can listen to that. You'll love the interview. It's wonderful. Everything we talk about are things you'll be interested in. But on that note, I want to thank you, Naren, for co-hosting this episode. I want to thank you and your team at Equa for all you do to help provide dentists with quality new patients. And also want to thank our listeners. We appreciate each and every one of you. Thank you for the privilege of your time. And come join us on April 24th for the Success Story panel discussion. Naren, give that link for where they can register. You have to register for that event. It's free.
Yes.
But give that link one more time.
thrivingdentist.com/webinar. That's the link you go to register.
Yeah. Hey, look forward to seeing you then. Thanks so much.